Hello everyone, this video presented by Vedant Sawant, Vaishnavi Jadhav, Vaishnavi Honkambale, Sarika Kharmate, Rohan Jhade, student Ashokrao Mane Institute of Pharmaceutical Sciences and Research, Save. This video guided by Mr. A. N. Dhage sir, subject Biopharmaceutics and Pharmacokinetics BP604T, previous year question. Objective question. Question 1. Give the characteristics of an active transport mechanism. Question 2. What is enterohepatic cycling of a drug? Question 3. List factor affecting protein binding of drug. Question 4. Give benefits of drug clearance. Question 5. Comment on particle size are a tool to enhance bioavailability of drug. Question 1. Give characteristics of an active transport mechanism. Answer. Active transport. Active transport is the movement of molecules across a membrane from a region of their lower concentration to a region of their higher concentration in the direction against the concentration gradient with the utilization or metabolic energy, ATPS. There are two types of active transport. Primary active transport that uses ATP, secondary active transport that uses an electrochemical gradient. Primary active transport, also called direct active transport because directly uses metabolic energy, ATPS, to transport molecules across a membrane. Secondary active transport, sodium glucose transporters. Sodium glucose transporter co-transporter are family of glucose transporter found in the small intestine. Firstly, sodium-potassium ATPase pumps out 3 sodium ions and bringing into potassium ions. This action creates a downhill sodium ion gradient inside of the cell. Sodium glucose transporters uses sodium ion gradient created by sodium potassium ATPase pump to transport glucose across the membrane. Question 2. What is enterohepatic cycling of a drug? Answer. Enterohepatic cycling of the drug is the drug pathway between liver and intestine. It continued until the whole drug is metabolized or excreted from the body. The drug which is excreted in the intestine via bile are not reabsorbed and excreted through feces. Enterohepatic circulation is a process. Drugs are conjugated to glucuronic acid, excreted into bile, metabolized back into free drug by intestinal bacteria. Drug is then reabsorbed into plasma. Lower doses of drugs can be therapeutically effective. Elimination is reduced by the recycling of drug. Enterohepatic circulation. Enterohepatic recycling. Substances are metabolized in liver, excreted through bile into the intestinal lumen, reabsorbed, returned back to the liver. Portal circulation. Circulation of bile from liver to the small intestine aids in digestion of fats, other substances. Important concept in toxicology. Lipophilic xenobiotics undergo this process, cause liver damage. Question 3. List factors affecting protein binding of drugs. Answer. Factors affecting protein drug binding. 1. Drug-related factors. A. Physiochemical characteristics of the drug. B. Concentration of drug in the body. C. Drug's affinity towards protein tissue. 2. Protein tissue-related factors. A. Physiochemical characteristics of the protein or binding agent. B. Concentration of protein binding component. C. Number of binding sites on the protein. 3. Drug interactions. A. Competition between drugs for the binding site. Displacement interactions. B. Competition between drug and normal body constituents. C. Allosteric changes in protein molecule. 4. Patient-related factors. A. Age. B. Inter-subject variations. C. Disease states. Question 4. Give benefits of drug clearance. Answer. 1. Clearance applies to all elimination rate processes. regardless of the mechanism for elimination. 2. In addition, for first-order elimination processes, clearance is a constant, whereas the rate of drug elimination is not constant. 3. It describes the relationship between plasma drug concentration and the rate of drug elimination. Question 5. Comment on particle size as a tool to enhance bioavailability of drugs. Answer 1. Micronization. Micronization increases the dissolution rate of drugs through increased surface area. Micronization of drugs is done by milling techniques using jet mill, fluid energy mills, etc. Micronization is not suitable for drugs having a high dose number because it does not change the saturation solubility of the drug. The process involves reducing the size of the solid drug particles to 1 to 10 microns, commonly by spray drying or by use of attrition methods. The process is also called micromilling. 2. Nanosuspension. Nanosuspensions are submicron colloidal dispersion of pure particles of the drug, which are stabilized by surfactants. Nanosuspension technology is used for efficient delivery of hydrophobic drugs. The particle size distribution of the solid particles in nanosuspensions is usually less than 1 micron, with an average particle size ranging between 200 and 600 nm. Advantage: increased dissolution rate due to larger surface area exposed. For example, nanosuspension approach has been employed drugs like paclitaxel, taraspide, amphotericin B, which are still on research stage.